Once again, we're having our dental chat with Dr. Bilski. Thanks for talking with us again. It's always fun.
My pleasure.
I know some folks have like receding gums, and just curious, what does it mean when that's happening? And is there speed difference in people? What should you think if it's happening?
Yeah, we get inquiries all the time online about receding gums. A bunch of different ways to handle this. How it happens, or how it can happen, there are a couple things. Think of the physiology. You have teeth that are sticking in the jawbone that have gums wrapped around them. So what occurs is when you get receding gums, the bone supports the gum. So when the bone shrinks back, the gum comes with it. So when you see patients complaining about hot, cold, sugar, air sensitivity or brushing.
Related to that?
Yeah, it's recession typically. It's exposed cementum and dentin, the doctor stuff, but it means you're not your nerves exposed, but your teeth are exposed. That transmits the hot, cold, sugar, air, sweet to the nerve. It hurts. Another cause of it is severe clenching, grinding, smoking, not properly flossing, brushing, and certainly not going to the dentist or seeing your hygienist regularly contributes. So it's really the start of periodontal disease or progressively destructive forces because you clench and grind. So we put that into periodontal disease with occlusal disharmonies. My gums are receding because my bite is not good. All right. Why is that? Could be missing teeth. Could be accident. Could be you didn't have braces when you were a kid. Maybe you had braces and the teeth were malpositioned because they wanted to make them look good, but we had to position the teeth not in the center or inside a healthy bone, so the bone receded. Then the gum receded. Mm-hmm. Now we have either loose tooth or sensitive tooth or exposed. So then, what do you do, right? Well, surgery.
Yeah, some painful. That was
right.
There's lots.
So there are specialty doctors, particularly periodontists. Okay, they do that. Oral surgeons may do this too. I would suggest they all do, but most of the time, a periodontist is seen first. And then there are some dentists like myself that provide these services. And again, it's to a point like, where do you feel comfortable? Like what makes sense to do that? And then that's when we ask our specialty people for our help to consult with these patients. So it's not just hearing it from Dr. Bilski, who you've been coming to for 34 years. Yeah. And I say, you have a receding gum line. What should we do? I said, you can do pinhole surgical. You can do dermal grafting. You can do a graft that we take tissue from the roof of your mouth. Those are all rather painful. All right, so that's the scary part. I can give my explanation, and then one of our specialty people in our community or another referral could be an hour away. Could be down in Columbus, which sometimes they send patients to my friend who is very well skilled in surgery, period. That's all he does. So it's just where the patient's comfort level lies with us, what I feel comfortable with my own techniques. And then the expectations of the patient, sometimes I don't maybe feel comfortable trying to meet those expectations because they're really, really, really banking on that. Yeah. And it's again, meeting expectations and being transparent, if you will, with the patient. Sure. And there's a lot of conditions. I know we talked to all patients are different and how they treat their medical and complexities, not complications, just medically complex medications. Some patients just infirm. They can't brush and they can't floss properly. So do we do those surgeries? Yeah. Do we not do those surgeries? Do we refer those? Dr. Bilski always has great information on stuff. And if you want to learn even more about oral health and bright teeth and veneers and all sorts of things, you can always visit the website, bilskidental.com. Lots of videos waiting there. And of course, if they want to, schedule an appointment, they can do it right there. Do it online or you can give us a call. Great. Check it out. Please do.